Miss Purple, the right mind for any time. I created this podcast to raise the awareness of mental illness. If you have any of these symptoms, notify your physician or call 911. Another suicide hotline is nationwide is 988. Thank you. Hello, my podcast today on Miss Purple. It's called Miss Purple, the right mind for any time. My name is Deborah Ann Sanders. Nickname is AKA Miss Purple. Born in Akron, Alabama, raised in Birmingham, Alabama. I had over 30 years of nursing service, mostly in mental health. I worked for the federal government at one time, LA County USC at one time, many private sector. Now I work at White Memorial Seventh-day Adventist under the direction of Dr. Michael Hernandez, who's bilingual. We also have a wonderful administration staff at White Memorial, and also the nursing staff is multiple racial. The first topic I'm expounded on is how to get into a psychiatric emergency department. There's 3 criteria: a regular admission, involuntary, and also admission based on medical problem. The first of volunteer, the person may come to the emergency room, or he or she may enter from their clinician office. The doctor assesses the patient, see he or she is ready for admission based on their mental health status. If you're the patient then admitted to the unit, and the patient will be on a voluntary status, not on a hold. The patient would become mental stable, he or she can sign himself out before a 72-hour hold. The next type of admission is involuntary admission. Involuntary admission is a 5150, or you put that legal, maybe by a police officer or somebody in the field, a pet team or a MET team, feel like you can't not take care of yourself, be a danger to yourself, danger to others, or gravely disabled. If a person meet that criteria, they're automatic admitted to the psychiatric department. Also, there's a certain thing called medical admission. Medical admission means that the person cannot take care of themselves and making bad decision on a life or death situation. 2 physicians come over and assess the patient and find out he or she is mentally incompetent, and they can be put into a psychiatric facility that way. Emergency admission means that the person is put there for 72 hours with or without conservative or consent from the patient. The decision is made by the doctor, regardless of the emergency admission as necessary. Emergency voluntary admission is that the patient is admitted from up to 72 hours on authority of the physician or someone that work with the PET team, which is a psychiatric evaluation team that goes out into the field, or the MET team, which is the mental health evaluation team. Sometime when the patient is brought to a designated 5150 hospital, he or she is put on a hold by a clinician that assigned to the emergency room, or if they have a psychiatric doctor down there, he or she can put that person on a hold. While in the hospital, there are several things that occur to an individual. He or she may be assigned as an inpatient. He or she is assigned to a psychiatrist, a psychologist, a social worker, also a nurse, physical therapy, OT therapy, and art therapy. Inpatient, when the patient come inpatient in an object of danger, we take away from them in the hospital, put it in a safe area, and when the patient leave, he get his stuff back. The patient's also got a wand to check his body when he's inpatient in the hospital, so that he or she may not have any contraband that's hidden. Also, the patient is allowed to wear clothes, but the clothes cannot have any strings on. While you're in the hospital at that particular time, your discharge is planned on your admission date. You met with the mental health team to try to figure out your treatment approach for that admission. And you would not be collaborating with anybody else until a timely manner. Once the admission is up, you'll be reevaluated in the mental health hospital. You may get to stay either from a volunteer, you may be put on a 5150 hold if your mental illness have not progressed to safety. Also, if you put in inpatient, your stay is planned. You can only pack a bag of comfortable clothes ahead of time, but also avoid any belt, string, or shoelace. None of that is potentially allowed in an inpatient hospital because it can be danger for the patient and also danger for the staff. Once admitted to the inpatient facility, the treatment, you follow daily and evening schedule. Meals, classes, individual group, family therapy, and also with the recreation therapy or the movement therapy. Thank you for listening to my podcast of Miss Purple, The Right Mind for Any Time. See you next time.